It's Dr. Karthik Ram. Welcome to my podcast. I'm a board certified plastic surgeon and educationalist based out of Chennai. I'm really honored that you have taken your time and given me your gift of your attention. Hope you are going to love this session. Please follow me in my Instagram handle for more updates. My Insta handle is Ram Dr. Karthik, RAMDRKARTHIK. Enjoy today's podcast. Hi friends. Yes, after a long gap, we are doing our plastic surgeon's diary. This is, I think, episode number 11, and yeah, a lot of interesting patients in the last couple of months. And Dr. Joyce is going to join with us live. We are going to talk about few important complications of liposuctions also, and few interesting cases, as you know. Yes, Joyce, welcome back to our plastic surgeon diary.
Thank you, sir. Thank you, long time.
Yes, Joyce. Yeah.
So the
You start.
disclaimer,
Yes,
yeah.
Joyce.
So the disclaimer being that we'll be talking a lot about our patients, but we make sure that we don't reveal their identity, so that we keep their privacy in safeguard. To start off with, we are coming up with the procedure before surgery. Post-operatively, after the third day of tummy tuck, she went missing, and she landed up with a huge complication, but we somehow managed to deal with it. So, sir, what would you like to talk about such kind of patients, and how do you deal with them, especially for young plastic surgeons when they're dealing with such kind of tough cases? You recently know about the liposuction patients which have got complicated and all that. So, when you have a troublesome patient and finally the liability comes on us, how do you deal with such patients?
See, the simplest thing is before surgery education. You have to make sure that they understand all the like pros and cons of the importance of coming for the regular follow-ups, and when they are abroad, they are going back. So that is very important. So see, sometimes very unavoidable situation. Even this patient is not doing it knowingly. Some family emergencies, and sometimes she can't communicate with us for anything. So third day she disappeared after the tummy tuck. We haven't heard anything. She hasn't come for the follow-up suture removals. We have not seen her at all, and WhatsApps are blocked, and we are so confused. But after probably after 25 days or something, she came with a huge skin death and big wound in the lower tummy. And she was also understanding. She's also know that the mistake what she has done, and immediately she has to travel back. She has not given any proper care to the wound, and she's carrying all heavy luggages and going here and there. She understands. She's not blaming us here, but the thing is, we also wanting to see the good results in our patient, not that like this kind of a complications. So we also feel really bad, but we manage effectively. The guys who are plastic surgeons watching, the how much of a bad that post tummy tuck, the necrosis, skin death, don't worry. Wait and let it separate and debride adequately. And see, the waiting is for not removing the normal skin. So when it separates, it's easy to remove only the dead skin. So remove the dead skin alone and put her on antibiotic coverage till everything recovers, and then make sure that you put them on back for a few days, not few days, actually at least 7 to 10 days. You need to put the patient on back, so wound shrinks. And one more advantage of back is the blood supply to the existing flap also like improves. So when you're doing a secondary suturing, survival will be better. Sometimes in that case, what I did is I put the patient on back for 7 days. After that, I did a secondary suturing of half of the wound. Then again put her on back for the remaining 3-4 days. Then I finished the complete closure. Okay, the wound is completely closed, though almost only 5 to 6 centimeter of the skin only left behind from the navel. So all the thing has gone, but we have managed to do the secondary suturing. Definitely, it's not going to be a very good scar, but definitely it is manageable, and patient is happy now. And in fact, she's asking for the breast implant now. Like after all those things, and I told her nothing doing for 6 months, come back after 6 months. But so it's easily manageable. Understand that. Yes, Joyce. Next case.
One of the things I've learned from you is however complicated or troublesome the patient can be post-operatively is to stick by the patient and be by the patient. So it's very surprising. See, when we have a complicated patient, we see so many surgeons complaining, but we have a patient who got complicated but is still coming back for another surgery. I mean, her asking for a breast implant is something, I mean, that's kind of rewarding for us also in our practice. I mean, so you have to stick by the patient. That's very important.
It's I vaguely
Yeah.
I actually remember one more thing I want to tell here. I was in Aston Baker Symposium in New York, and Dr. Baker was presenting about series of things. And that time he said I used to get a lot of calls from my junior colleagues about complications. One of the thing is first face lift surgery he has done in private practice. That is junior, and all the facial nerve branches has gone. He doesn't know what to do, and immediately he called Baker, and Baker told, it seems, first you available for the patient all the time, and sit with the patients, understand her problems, and wait patiently for a few weeks, and everything will be fine. So actually, that patient recovered well after 6 weeks from the time of after 6 months from the time of surgery, and that patient is bringing a new patient to the surgeon after 6 months. That is, like, see, complications. Like, you have to avoid the complications. Sometimes beyond your control, complication might happen. Only what you have to understand is, if the complication comes to you, you put yourself in the patient position, what you want the surgeons to do, what you expect the surgeons to do, you do the same thing to the patient, and make sure that she will be happy client even after the complication. Okay, so this is Baker's thing I want to share here. Yeah.
So now it's a trend of fillers, and we see a lot of patients coming up with this trend of being filler addicts. So we had a recent experience with one filler addict, and we realized that it is, more of a psychological problem with that person rather than, something or physical that needed to be corrected on the face. So, Dr. Karthik, please elaborate on this case and how did you deal with it, and what is the signs that you picked up that you have to be aware of such patients?
See, this filler patient is treated in Delhi most of the time because she was in Delhi. I changed all the city names and all everything because I don't want to reveal the patient identity. And so they are usually inject a lot of fillers in the face, and she keeps going for the fillers, it seems. And that's what she, initial consultation, she revealed to me. She looks pretty. She's 35 plus, but still for that age, she looks very pretty. Not much, the aging signs have set in. But she keeps asking, I want a little bigger jaw, bigger cheeks, and I want a chubby look. I don't want the sunken look. Give fillers here, filler here. Actually, we have discussed a lot, and then we have decided for a fillers for the cheek, and I think nasolabial fold. And I told her immediately after surgery, one side it looks a little bulgier. Wait for some time, it settled. Okay, so that's what I told. She jumped and came back on second day itself and asking that, no, you said something. No, now its cheek looks horrible. Please do something. I want to get corrected. And I told her, see, that day it was bulgy, but today it is not bulgy. But still, you don't like it, I can reverse it. But my advice is, you have to wait for a week. Then only you can see a kind of the swelling should have settled. Then only we can plan the removal of the filler properly. She said, no, I can't wait for a week or all. I can't go like this kind of. Actually, she looks perfectly normal to me and as well as for my colleagues, all my colleagues. But I don't want to argue with her because after so much years of practice, no, better to do things what they want and get rid of the issues than like making her understand. I tried to understand for a few times, but it's not working. But I just reversed a little bit of filler here and there using the Hyalase, and she was kind of happy. And I am not blaming her. She doesn't like it. That's it. So probably my words that day when I did the injection, I said one side was a little bulgy. I want to be truth to the patient. Sometimes it backfires also, so it doesn't matter. So the other funny part is she came after a week or 10 days and asking that, Karthik, you feel that some more fillers from here and there might help? What do you feel? I told you, I'm looking perfectly fine. You don't need any fillers. So, I don't want to fight with these patients again and again. We have a lot of patients to treat. So I didn't encourage the filler, and we sent her back. In fact, she asked the money back for the filler, what we reversed. That's even more horrible. So sometimes it happens. Yeah.
Okay. A very educative week for Chennai Plastic Surgery. One of our papers on gynecomastia and how we deal with grade 3 and 4 has come out as a publication in one of the most reputed international journals. Dr. Karthik, this is one of the many publications that you're going to get in hand. So, what are your feelings and how do you feel about this whole publication?
Actually, we have to thank Dr. Sanjeev and Dr. Jagdish only for this article, along with as well as Joyce. And the thing is, I'm little, our idea of publication, and we are hesitant to put papers and publication because various, I don't know, it's a mind block. When Jagdish started this work and Sanjeev started continuing that work and finished the work, even the multiple lipoma article also got published recently. So 2 articles are already published. And see, the NAC plaster lift technique was really, really, it's going to be helpful for the surgeons across the world, because the grade 3 and grade 4 gynecomastia, when there is a lot of redundant skin, managing is extremely difficult one. Either they need to go for a double incision mastectomy or free nipple graft, or 2-stage procedure like a first gland excision, then go for the Benellis procedure, or a single stage procedure like a gland excision and Benellis procedure, which leads to a lot of skin death. A lot of complicated stuffs are there in this grade 3 and grade 4 gynecomastia. Putting this lifting plaster will manage this issue to the extent. Maybe we can say that 80% of the problems are solved because of the NAC plaster lift technique. So we are doing it for the last 4 years, but still we are not publishing. So this time we published the article. We want to make sure that everybody uses this technique so that results of the grade 3 and grade 4 gynecomastia will be good. Same way, the multiple lipoma, also I am doing this technique for the last 12 years. In fact, I have not published it. And this is also going to be the useful thing, because when there is a lot of lipoma swellings, you need not make multiple cuts to remove each lipoma. So, example, 10 lipoma in the forearm, you need not put 10 cuts to remove the 10 lipomas, which leaves to a 10 scars. Obviously, the patient coming for the multiple lipoma surgery doesn't want the scar. Tinku, hi. Tinku is saying hi to us. Okay. So, multiple scars they don't want. So obviously we want to reduce the number of scars. This technique is going to be really useful for the plastic surgeons as well as a lot of general surgery colleagues also. In fact, we used to get clients across the world for this procedure because nobody does it. People, please do watch the videos. I want the clients across in your area to be helped with these techniques so that they do not come to us for these procedures. And I'm very happy that we had 2 publications now.
See, the emotional outburst with respect to gynecomastia patients, I think we've seen a lot. But recently, there was a very heart-touching, very moving sort of an experience post-operatively from your patient. And I think, Dr. Karthik, you noticed it. Elaborate better how it was.
You were not there during the time when he's recovering. Actually, it's a grade 4 gynecomastia, and he's a doctor, and he's studying somewhere of Tamil Nadu. He finished his course, and he came all the way from there for the grade 4 gynecomastia correction. And after everything over, we put the lifting plaster, and everything is over, and he was extubated, and suddenly he was gasping. And anesthetist went to the other side of the theater. So I called the anesthetist, and he held the hand, saying that, "Doctor, I'm all right. I'm completely all right. I'm crying, actually. I'm emotionally very upset. Today, now I'm happy, but it's very emotional things. So I have nothing to do with the breathing issues. So don't worry, kind of." Then we consoled him, and he said it's very normal to be emotional and labile immediately after surgery. And that much mental disturbance they go through because of the gynecomastia. That's what people have to understand here. And next day, he came for just a review. And he said he's the best outgoing student in the college. And he said, even when I got the award for the best outgoing student, I was not happy, doctor. And last 2 years, I'm trying to prepare my postgraduate exams, but I can't prepare because of this issue. It keeps disturbing me so much. And the best day and happiest day in my whole life is today only. I got rid of this issue. And you don't even know how much it helps me. It helped me, kind of. So it's really touching, actually, that he said, "I don't want to mask my face. I want to talk about it somewhere kind of, like that much he wants to help the other people also, like who are suffering from the grade 4 gynecomastia, grade 3 gynecomastia, how much mental agony they go through. Obviously he projected those things to us, and obviously he is going to write a big blog about his whole experience and going to post somewhere. So, yes, gynecomastia, all the cosmetic surgical procedures are really a disturbing, emotionally disturbing one, and it increases the self-confidence. It makes them socially, like even attending the social function they avoid, attending case, like taking a photograph they avoid. Like though it looks all small, silly things, but when it comes to you, you understand how much big thing these are.
So coming about many educative things, now a paper has been published. There's another thing that you have recently you wanted to speak about, and I think this is a nice forum to talk about it, and that is the seroma problem. And what is your take on it? How do you manage such kind of a problem?
Okay, see, we also learned a lot through the like a lot of years of experience. The seroma is nothing but the fluid collection accumulation in between the skin and the muscle layer. It happens in few cases, especially the gynecomastia surgeries, tummy tuck surgeries, sometimes rarely in liposuction surgeries. We keep wondering why it is happening and how to prevent it. See, it's like a normal phenomenon. If there is any external wound, what happens? Some fluid exudates from that, come out of that wound, and it soils your dresses and other things. The same kind of a fluid secretes inside, because we do a lot of trauma in the wound inside, so that the fluid keeps secreting. Okay, but usually body will handle the secreted fluid and absorb well. Joyce, even I haven't discussed with you why in gynecomastia and tummy tuck we are getting the lot of seromas than other areas. Major thing is we remove all the fat layer in gynecomastia as well as in tummy tuck. Okay, leaving a very little. Okay, but in liposuction, though we do complete liposuction, when you open, you know how much we leave behind. Okay, a lot of fat layers are intact. So leaving a thin layer of fat cells over the in tummy tuck, corpus fascia, in gynecomastia, over the muscle layer, over the fascia, very thin layer. Not you need not give a like a very much left leave and come. Very thin layer of fat you leave and come. Absorption will be better. Okay, so we noticed recent times, 6-7 months back, we are very aggressive. We want to remove everything. We used to see a lot of seromas. Now we are a little less aggressive and keeping a little bit of fat layer here and there, so that the seroma formation is very less nowadays. You agree with me, Joyce?
Yes, sir. Very much. Very true.
Yeah. Second thing, obliterating the space. So we don't put a quilting sutures in the gynecomastia, but tummy tuck, we started using quilting sutures. That also reduces basically we have to obliterate the space. So that also reduces the seroma incidences. And a lot of people, it's a proven technique. Here, a quilting suture means if there is a skin, there is a muscle, we connect these two things with small sutures in between, so that the cavity will be obliterated. And third thing, keeping a drain. So in tummy tuck, we don't keep a drain more than 24 hours. Sometimes, very rarely, with a big cavity, up to 48 hours. So what we found is we keep the drain, you keep sucking the fluid continuously. What happens is you are not challenging the other channels to open up to absorb the existing seromas. So usually we remove 48 hours. There won't be much problem. Probably I can say 20% of the tummy tuck patients come back for a mild aspiration, but we don't have any major seroma issues in our tummy tuck patients. So obviously the difficult seromas happens only after 7 days. Not that first 1 week of the time. 1 week of the time, some fluid collection and some blood collection, all those get absorbed well by the body. But the difficult seromas happen only after 7 days. So those cases, obviously keeping a drain for few days doesn't help. Yeah, I keep a drain, sometimes even a bigger gynecomastia, when I feel that lot of the dead space and lot of because some seroma collection will jeopardize the skin blood supply also. Sometimes nipple necrosis are common if you are keeping the seroma for longer time without addressing it. So for those reasons, for the major gynecomastia or major tummy tucks, we keep a drain for some more time, but not in a regular basis. And so this is about the drain. Okay, when the seroma happens, what we will do? One more reason for the seroma is the protein deficiency, because massive weight loss patient, post bariatric, or a patient on chronic dieting, they have the protein issue, so we might need to give albumin infusion few cases so that the seroma formation won't be there. When it happens, regular tapping is necessary, and don't keep the seroma for longer times, saying that it will get absorbed. Small quantity is fine, but major longer, if it's what do you call that? The fluctuation is present, just better to remove it. And even after 4-5 times of the removal, one more thing is putting a doxycycline injection inside the cavity will it act like a sclerosing agent, and it will help. And even after that, you have you can try the doxycycline and two times at least. Even still it is not working, you keep a small drain, and in fact you can give a regular betadine wash through the drain. And because betadine was diluted betadine also act like the sclerosing agent, so that also helps you in managing the seroma well. So these are all the wide, but if you ask me, only 0.1% of the people have this kind of a resistant issues. Most of the other patients will very much resolved by the minimal measures, like just tapping with a syringe and proper compression dressings. One more I forgot to mention is the compression dressing. Post-operative compression also matters a lot when it comes to the seroma. If you're not compressing the skin and the muscle properly, there is a dead space, fluid tends to accumulate. So the compression government also very much important in the post-operative seroma management. I hope I covered everything, Joyce.
Yes, sir. Everything is covered. Now, next we come to a very interesting part, and that is how do you deal with different kind of patients. So of lately, I know you've been suffering with a stalker kind of a patient who's been stalking you from hospital to clinic and from clinic to hospital. I'm glad he's not reached home yet. So what would you want to talk about such a patient?
See, the body dysmorphic disorder patients is difficult to handle, we do know. But sometimes that the disease progress is so extreme, we don't know how to handle him, because he comes every day and sits and asks for a surgery. We say nothing wrong in you, go back. It's not going. He goes to all other plastic surgeons also and come back and settle, no, you go to operate. Nowadays we are there, the front office saying doctor is not available and please go back. I have to, see the patients only in different places, not to come to the center because his torture is too much. We totally understand he is not mentally normal, mentally unstable, and we want to help him. He's not going to the psychiatrist. Even I said the same. If you go and meet the psychiatrist and get the medicines and come, I'll do the surgery. He said, I don't have any problem. Why you want to send me to psychiatrist? I know how to handle this clients. I really don't know. And even he's hitting the parents, and home also a lot of problems. I don't know. It's a difficult patient. Still struggling. Anybody have some ideas of dealing with the patient? Or I don't want to hurt him because he's not normal. It's not. He's not psychologically stable. So going legally, I don't want to do it. But it disturbs my practice every day almost. So I still confused. I want some answer from the plastic surgery colleagues who are watching this.
Okay. So lastly, the last case is attitude matters a lot, and humility also matters a lot, no matter which position you hold, whether you're a celebrity or you're a normal patient. And I'm sure in our clinic, in our practice, we try to give everybody the equal importance. Celebrities also, we give them their due importance. But however, sometimes certain attitude of celebrities is very, very disturbing. One such recent experience you also should be able to recall. What would you say for such kind of people?
See, obviously we understand the celebrities' issues. See, when they're coming and sitting in the OP, obviously everybody will notice them, and it's not a good thing for them. So obviously I give a timing so that time not much patients will be there. So the privacy is not altered. Like that only we give appointment. Rarely, like sometimes the surgery getting delayed. Sometimes there will be a mix. The events might clash, so that they might need to wait for a little longer time. So normally I say them, see, please you wait in the car till everything settles. I'll call you. We give importance to the celebrity not because they are different. The same treatment the treatment wise everybody going to get the same, but because the privacy issues sometimes yes, we give importance to the celebrity. One of the celebrity, one of the actresses, and she came for some consultation, and in fact I spoke to her even the previous day and told her come between this time. She came and waited for 10 minutes. Then he said, no, I'm not going to sit here. I'm going to go back. Okay. Sometimes, like people are not understanding the what we are going through. See, we have to do 4-5 surgeries in the morning. Then we have to come for the OP. OP also, we want to, like manage such a way that people should not wait. But even, see, in our practice, you do agree with me, Joyce. We never make any patient wait more than 15-20 minutes. Extremely rare if people goes and waiting more than this. When we are fast in seeing the patient and give them immediate, as soon as we come, we finish the OP faster. But still, some people, like everything happens for a reason. If she wants to go, it's good for her and good for us sometimes. So I'm not bothered about it, but attitude. See, waiting for, even I know a lot of actresses, bigger people, they come and wait patiently without any kind of a fuss. Though they're very popular, very famous, there are a lot of people like that, and a lot of people like this also. We have to handle both the patients, what to do.
Yes. So, sir, this brings us to the end of this time's Plastic Surgeon's Diary. It was a very nice mixed experience. Spoke a lot about our publications and papers, and also about a lot of patient experiences. I hope we have a much more interesting next time episode also. So, thank you everyone for listening. Thank you, sir.
Thank you, Joyce. Thank you all.